Malawi is home to a fast-growing population, and its public health system faces substantial challenges. Yet, in recent years, the Ministry of Health's efforts to provide high-quality medicines and health commodities for its citizens are paying off. The government's initiatives, such as the malaria, HIV, and tuberculosis programs, have made significant progress. To continue improving the availability of vital health supplies, the Ministry of Health has identified supply chain gaps.
At the moment, the biggest challenge that we're actually facing are shortages. Shortages are happening at all levels for varied reasons. But the number one reason is really to do with the information creation, generation, and use for decision making. The Master Supply Chain Transformation Plan is really one that at the center of it we want to coordinate the transformation of the whole supply chain over a period of 2021 to 2026.
The United Nations World Food Programme, WFP, has a strong relationship with the government of Malawi, as well as local humanitarian and health actors.
Over the last few years, WFP, as the co-lead of the National Transport and Logistics Cluster, has been supporting the government of Malawi with a wide range of logistics services, and most recently, the response to the COVID-19 pandemic. We've been supporting a wide range of partners by storing essential medical supplies, setting up screening areas in airports, isolation and treatment centers at health facilities, and container labs at border posts. The establishment of humanitarian staging area in the southern region of Malawi, for instance, will help save valuable time and resources in deploying emergency assistance when the next crisis strikes.
In the past, WFP has successfully supported other African countries. In Guinea, for example, WFP worked in collaboration with the Ministry of Health to optimize the usage of its central medical store's fleet of vehicles. Over a period of 3 years, WFP provided technical advice, new fleet management tools and targeted trainings for the central medical store's drivers and mechanics, helping to improve the delivery of health commodities across Guinea's 600 public health facilities. In Côte d'Ivoire, WFP partnered with the Ministry of Health and Public Hygiene to improve the end-to-end visibility of the health supply chain in the country. WFP introduced monthly dashboards, known as the Control Tower approach, to visualize key supply chain information and alert users on potential issues and stockouts. With these better analytics, life-saving health products such as malaria and HIV treatments can now be delivered in a more efficient way across the country.
As we go along, we see that basically WFP has got so much potential to actually participate in the transformation of the supply chain in Malawi.
WFP and Takeda Pharmaceutical Company Limited are now partnering to support health and government partners in Malawi with supply chain management solutions from WFP's experience in food logistics. Based on the needs expressed by the government of Malawi and the experience of the Health Supply Chain Project in other African countries, WFP will work with all partners to define best suited local solutions and contribute to the improvement of the Malawian public health system.